There we go. So, Nikki, can you tell us what treatment did you have done?
Yes, Tom. So I had a baby tooth that the second tooth never came through, and eventually the baby tooth disintegrated and needed to be removed. So I talked to my dentist about what we could do, and she recommended that I come and see you for an implant. So I came to see you probably about 6 months ago. I was very apprehensive about what that would mean in terms of having an implant, but you consulted with me. And I've now had an implant fitted successfully, and this is my last checkup with you.
Fantastic. So how was your experience overall?
So there were various stages of the treatment that I didn't completely understand at the beginning, but you were very kind to talk me through those. So we had to remove the old tooth. You inspected my mouth to see if there was sufficient bone there and whether the gum was healthy. We decided we might need to put some extra bone in, which we did. So we needed for that to take, which took a few weeks. You then explained that I would have a tiny titanium screw inserted, which would hold the implant in place. That felt a little bit scary, but when you did that part of the procedure, I didn't feel any pain at all. I was quite amazed. In fact, I went shopping afterwards. And then we waited for that to take, and then a few weeks later I came back and you fitted the implants, and it was as though I've never not had a tooth there.
Okay, so how would you rate your experience? Would you recommend it to anyone?
I would definitely recommend it to anyone who is worried about having an implant treatment, because I've never had great experiences at the dentist throughout my life when I was little. So Tom, I have to say you made the experience extremely great. I felt very relaxed. But I can honestly say I didn't feel pain at all throughout the whole time. The only slight twinge was after we fitted the screw, and the painkiller wore off, and I just felt a little bit of aching in my gum for a couple of days. But nothing in the way of pain at all. So for anyone that's thinking about having an implant done, I would strongly recommend you come and have a consultation.
All right, Nikki, thank you very much for your testimonial. And yeah, any queries, any problems in the future, I'm happy to see you back. Thank you very much.
Thank you very much, Thomas.